How to complete the prescription drug template. Issuers seeking to offer qualified health plans, or QHPs, including standalone dental plans, or SADPs, on the federally facilitated exchange must submit a completed QHP application per CMS guidelines. As part of the QHP certification process, issuers are asked to fill out several templates with issuer and plan-level data. These templates, along with any supporting documentation submitted, comprise an issuer's QHP application. Among these templates is the prescription drug template. The prescription drug template collects formulary information associated with an issuer's plans. A formulary contains cost-sharing information for drug benefits. The template creates unique formulary IDs that are later mapped to plans entered in the Plans and Benefits template. To download the prescription drug template and applicable instructions, visit the prescription drug webpage of the QHP certification website. This webpage contains more information about the prescription drug section of the QHP application, including tips and additional resources. Before filling out the prescription drug template, download and read the instructions from the application resources section. Additionally, you'll need a list of valid RxQEs. Download the most recent list from the Unified Medical Language System, or UMLS. If you do not have an account or license with UMLS, refer to the QHP application instructions. Issuers are permitted to offer drugs that do not have associated RxQEs, but those drugs should not be included in the prescription drug template and are not used in evaluating essential health benefit or EHB benchmark or non-discrimination compliance. Once you're ready to complete the prescription drug template, download the template from the Application Resources section, open the template, and enable macros. There are two worksheets within the prescription drug template. The Formulary Tiers worksheet allows you to define the cost sharing for each formulary and associate each formulary with a drug list. The Drug Lists worksheet collects specific drug information, including drug tier placement and utilization management requirements. A drug list can be linked to more than one formulary, but a formulary cannot be linked to more than one drug list. Now let's walk through filling out the prescription drug template with sample data. Before you begin, look through the data elements required to ensure you have the necessary formulary information to successfully complete this template. To begin, in the top left corner of the Formulary Tiers worksheet, enter the 5-digit HIOS issuer ID you received when you registered in the Health Insurance Oversight System, or HIOS, in the state where the applicable plans will be offered. Then navigate to the Drug Lists worksheet, where you will enter all RxQEs included in your drug lists. All RxQEs should have one of the following term types in the UMLS list: Semantic Branded Drug, or SBD, Semantic Clinical Drug, or SCD, Brand Name Pack, labeled BPCK, or Generic Pack, labeled GPCK. The drug list should include all drugs on your formulary, even if the drugs do not fall in one of the categories and classes identified in the Summary of EHB Benchmark information. After you've filled in all RxQEs for your drug list, complete the tier level column by selecting the RxQEs cost-sharing tier from the 7 tier levels available in the drop-down menu. If the drug provided in the RxQE is not part of the given drug list, select NA. The Prior Authorization Required field is required if anything other than NA was selected for the RxQE's tier level. In this field, indicate whether the drug requires the prescribing physician to obtain prior authorization before the plan will cover the drug by selecting Yes or No from the drop-down. The Step Therapy Required field is also required if you selected anything other than NA as the RxQE's tier level. Here, indicate whether the plan requires enrollees to try at least one other drug before the plan covers the given drug. If you have more than one drug list, select Add Drug List at the top of the worksheet. To remove the most recently created drug list, click Remove Drug List. CMS requests that issuers remove drug lists that are not used. Unused drug lists include those that are linked to formulary IDs that do not associate with a standard component ID. Note that drug lists are removed in the reverse order they were created. If you want to remove a drug list that is not the last one created, copy and paste the data from the last drug list into the drug list you want to delete, essentially overriding the data previously there. Then remove the final drug list. Once you've completed the Drug Lists worksheet, navigate to the Formulary Tiers worksheet. Click the Create Formulary IDs button and enter the number of formularies you intend to associate to plans in your QHP application. Click OK. In the first cell under the Formulary ID column, use the drop-down to select the formulary IDs the template generated. The drug list ID field will auto-populate if you only have one drug list. If you have more than one, select the drug list ID that should be associated with this formulary ID. Next, select the number of tiers in this formulary. This should correspond to the number of tiers in the selected drug list. A maximum of 7 tiers can be used to describe your formulary. However, you are not required to use all 7. The next field, Drug Tier ID, will auto-populate based on your selection in the previous column. Note that all drugs within the same tier should have the same cost-sharing structure. Next click here to select in the Drug Tier Type field. In the dialog box that appears, select the drug types that apply for this drug tier. Choose a maximum of 2 drug types, 1 generic and 1 brand type. Choose specialty drugs if you only have one specialty tier. If you have both preferred and non-preferred specialty drugs, create 2 tiers. Designate the first as specialty preferred brand, and designate the second as specialty non-preferred brand. Differentiate between the two using cost sharing. Choose zero cost share preventive drugs if you have a preventive tier. If this is selected, it is the only type that can be selected for the tier, and the next 2 elements will auto-populate with $0 and 0% respectively. If you select this tier, please associate it to Tier 1 to represent the lowest cost tier to the consumer. Choose medical service drugs if there are medical service drugs in your formulary. If this is selected, it is the only type that can be selected for the tier, and the next 2 elements will auto-populate with not applicable. Note that preventive services under the Patient Protection and Affordable Care Act must be covered without requiring the consumer to pay a copay, coinsurance, or meet a deductible. CMS recommends placing these drugs into a separate zero-cost share preventive tier. Once you select the drug tier type, click OK and complete the 1-month in-network retail pharmacy copayment field. If you select one of the dollar value options, input the dollar value for the copayment. Select Not Applicable if the consumer only pays a coinsurance for the tier. Next, complete the 1-month in-network retail pharmacy coinsurance field. Similar to the previous field, if you select one of the percentage value options, input the coinsurance rate in the dialog box that appears. Select Not Applicable if the consumer only pays a copay for the tier. Note that both the copay and coinsurance for the previous 2 fields cannot be not applicable unless the drug tier type is medical service drugs. To indicate that a tier has no cost sharing, but it is not labeled as a zero cost share preventive, select either No Charge for the copay and Not Applicable for the coinsurance, or Not Applicable for the copay and No Charge for the coinsurance. In the next data element, indicate whether the drug tier offers 1 month out-of-network retail pharmacy benefits. If you select Yes, fill in the information in the next 2 fields. Similarly, indicate whether the drug tier offers 3-month in-network mail-order pharmacy benefits. If you select Yes, complete the following 2 data elements. Finally, indicate whether the drug tier offers 3-month out-of-network mail-order benefits. If you select Yes in this field, enter information for the final 2 columns. The selections for the copayment and coinsurance fields will be used to derive the deductible information for each tier, so be sure to select after deductible or with deductible when applicable. Once these fields are complete, continue adding formulary IDs and drug tiers as appropriate until all formulary IDs have been entered. Any cost-sharing features that cannot be captured within the template should be explained in detail in any consumer-facing materials. Now let's validate and finalize the template. Once you have completed the template, click the Validate button in the top left corner of the worksheet. Any data issues in your template that need to be resolved will be displayed. Correct these and click the Validate button again. Continue this process until all errors have been resolved. Once the template is valid, click the Finalize button to create an XML that will be automatically saved in the same folder as the template. The XML extract is the file you will submit as part of your QHP application. If you have questions regarding your QHP application, please contact the Marketplace Service Desk at cms_feps@cms.hhs.gov or 855-CMS-1515. For more information about the QHP certification process, visit www.qhpcertification.cms.gov.